What is the clinical picture of the patient who is suffering from hypothyroidism? What are the different signs and symptoms he or she may present if he or she is suffering from the hypothyroidism? Now, let's see what are those clinical features that are presented by the patient. As you know that thyroid hormone is circulated throughout the body, so almost all parts of our body will be affected when there is a decrease in the level of the thyroid hormone. Let's discuss them one by one. First of all, there can be the coarse, brittle hair that can be a manifestation of the patient who is suffering from hypothyroidism. There can be the periorbital edema and puffy face. Now, obviously, there is a decrease in the body's metabolic rate, basal metabolic rate, that is causing the maxoedema, and ultimately the face will be puffy, and the most prominent puffiness and thickness will be on the face, specifically on the eyes and the periorbital area. There will be the periorbital edema and the puffy face. Large tongue can also be observed, and then there can be the muscle weakness. Discussing about the muscular system, as the metabolism of carbohydrate is decreasing, the production of the protein is decreasing, overall the basal metabolic rate is decreasing, that can cause the muscle weakness. Then there can be the menorrhagia that can also be observed, maxoedema, madness. Now maxoedema can also affect the brain of your body. Then there can be the pallor that can be seen. There can be the hoarseness, the voice can be changed of the patient who is suffering from hypothyroidism. And also, in case of the patient who is suffering from goiter, the patient may have a severe cough, or the patient may suffer from the difficulty in the swallowing. This is the case in the patient who also have goiter or have goiterous hypothyroidism. And also the goiter is not painful, it is painless, but it causes problem in the swallowing, and it causes coughing as well. Then there can be the maxoedema of heart. So this hypothyroidism can also affect your heart and cause swelling and edema there as well. Then there can be the gastric atrophy that can be due to the hypothyroidism, and this is how this disease is going to affect the gastric system. Then there can be the constipation, and there can be the peripheral edema. Now, the peripheral edema, and most common is the edema of the lower legs. That is the most prominent feature of this disease. Now you are aware of everything about the hypothyroidism. You know what it is, what are the different causes of the hypothyroidism, and what are its different types. And here I told you about the clinical picture of the disease. Now recall the case that we discussed in the start of the lecture. 56-year-old female who was suffering from a disease that caused puffiness of the face, skin thickness, he's dizzy, and all the symptoms that are related to the brain, that he's lethargic and a bit depressive, and also he has skin swelling. These all were the features of the woman. Now you can see that these are all the symptoms that a patient suffering from hypothyroidism can have. Also, if you remember that during investigation, it was found that the level of the thyroid hormone was low in the female. So again, it is a confirmation that there is a decreased level of the thyroid hormone in the female, and there are all the symptoms that can assure you that the female is suffering from hypothyroidism. So the disease the female is suffering from is the hypothyroidism. And what can be the causes behind this disease? There can be some central cause, or there can be the iodine deficiency. Iodine deficiency is the most prominent cause, as the woman is a housewife, and this can be the only reason, because upon examination, no other disease was found in the female that can be a reason of the thyroid disease or the hypothyroidism. And also there is no other factor discovered or investigated. So this was the answer of the case study, and this is how you can diagnose a patient who is suffering from hypothyroidism. Just from the facial expression, the puffy face, thickness of the skin, you can notice that the patient is suffering from the hypothyroidism. And also the symptoms related to the brain, the puffiness, the fatigue, lethargy, and confusion, and the problem in mental alertness. All of these things will also highlight that the patient is suffering from hypothyroidism. So this is how the hypothyroidism is going to affect the gastric system, cardiovascular system, also our brain, eyes, face, skin, the muscular system, and the reproductive system as well. So this was all about the hypothyroidism. Thank you for watching sqadia.com.